Hello and welcome to a new episode of That Fertile Feeling, the podcast. My name is Françoise and I'm here today with Kimiko Kleiman, who used to work as a fertility doctor in an academic setting. Now she started her own independent practice. So she no longer works in the hospital, but she still guides couples on their journey towards parenthood, focusing on hormonal support, diet, but also really the mental and emotional side. Um, and I've mentioned this on the podcast before. I got pregnant twice through IVF, so I'm definitely a fan of IVF. And I also feel that there's so much more to fertility than just the technical procedures. And that oftentimes we go to fertility treatment way too soon, that there's so much more that you can do yourself to really invest in your fertility. So I was really excited about talking to Kimiko today, seeing why she made that switch in her career. So welcome, Kimiko, on the show.
Thank you.
And maybe you can tell us a little bit more in your own words about who you are and what you do.
Well, just like you said, I'm Kimiko, and I used to work as a fertility doctor. Before that, I used to work as a gynecology trainee, and I did my PhD in fertility. And then I got to miscarriages. It was in the same time that I run the miscarriage consultations in the AMC, in the Academic Medical Center in Amsterdam. So I actually was the doctor and I became the patient. And after two miscarriages, we didn't find anything in the hospital. So I went to a Chinese doctor. I went to an Ayurvedic doctor. I did a research on the literature for supplementation. I tried to deal with my stress factors. And luckily for me, the third pregnancy was my son now. So it was a good pregnancy. And I really don't know what of all those things I did brought me the third good pregnancy. Then I changed when he was born from gynecology trainee to fertility doctor because I really didn't like the obstetric part and I just wanted to help people with having a baby. A couple years after that, we decided, my husband and I decided to try to get another baby. And well, it actually didn't work for 3 years. Nothing was wrong, although we couldn't find anything, just as what happens with my miscarriages. Of course, I ran the test in the hospital and we didn't find anything. At that time, I was the fertility doctor instead of the gynecology trainee, so I became my patient again. My own patient in my own fertility department. And I think, I'm not quite sure, but I think it was a bit later that I started the training for hormonal therapist. Because what I did when I got those miscarriages, which was looking more broad, I did it again, of course, when we tried to get the second baby, but it didn't work. In the end, I also needed IVF, so I got my daughter. We had two children. Since that, I think it's not either way or the other way. It's both way combined. And well, then I was fertility doctor, hormonal therapist. I had my own experiences, and then I thought, okay, now it's time to open my own. Yeah, well, it's called Sakura Clinics, but actually it's not a clinic. I don't have a hospital. I don't do any treatments, but I just support people in the holistic approach to have or hold their babies, because I also see people with recurrent miscarriages or one miscarriage.
Thank you for sharing. And
Yeah,
I,
sure.
what I think is really important what you're saying is that it's not one or the other. So you have that holistic approach to fertility. You also have that more medical approach, and sometimes you just need both. And I think that's one of the dangers nowadays of, all the information that's out there on social media. It makes it seem like, and I want to phrase this carefully because I also feel there's much more that women can do
Mm-hmm.
than we know. Like there's so much more that our bodies are telling us, and we're
Yeah.
just not used to reading the signs. So on the one hand, I do feel we have that agency, but on the other hand, I've also had people tell me like, "What? But if you needed IVF, then maybe you just weren't able to heal yourself enough." And I find that also really painful for people who do need those treatments in the end to get
Yeah,
pregnant.
yeah.
Um, I even get goosebumps when I say that now. Yeah, it's not an either or, and it's so important to look at both sides of that coin and see really how they can complement each
Yeah,
other.
and to be honest, in English and in research, we call it complementary therapies.
Mm,
And that's exactly what it is. That's the right word. It's complementary. So it's just, yeah, we can do both. And
hmm
in my opinion, doctors look at their own scope and therapists look in
hmm
their scope.
Yeah.
But most of the people, yeah, I think they, well, not actually that they need both,
hmm
but it's good to know both opportunities
Yeah.
and the possibilities that can help you. And to be honest, of course, I started as a medical doctor and my scope was also to the medical protocol.
hmm
And I had a hard job in sticking to that protocol for some people.
hmm
So sometimes I did some things outside of this protocol,
Yeah.
and well, colleagues were not always very happy with those kind of things. But I was a patient myself, and even before I became a patient myself, you look at women, you look at people, and yeah, well, to be honest, no one fits completely in a protocol. I think it's you have the medical part on what I take care of in the hospital. You have the what I call the hormonal part,
hmm
what I learned as a hormonal therapist, with the kind of foods you can eat, the supplements, the lifestyle. Be careful for intoxications, and a mental part. It's so much more broad than we think.
Yeah.
It's the combination of all of it.
Yeah. Yeah. And the funny thing, like I was looking at my own clients a while back and I realized half of them are doctors.
Oh, yeah. Well, with me in Sakura Clinics,
Yeah.
it's not very different.
Yeah. And I think that makes so much sense because doctors, that was my explanation in the end. Doctors know what they can expect from the medical field
Yeah.
and where, and that I had someone say that on a podcast once, like you shouldn't expect your doctor to give you nutritional advice. That's just not what they do. So if
No.
that's something you feel you need, then you need to find that additional
Yeah.
expertise. So, oh, it's funny that you have the same
Yeah.
experience that,
Yeah, I do have.
yeah.
And to be honest, what I learned when I got a medical doctor was there's a problem. And we learned, okay, what's the solution? So most of the time, the solution is do some laboratory tests, see if there were problems with the egg, problems with the tubes, problems with the sperm, and then make the treatment and do the thing. And yeah, well, then for a lot of people, it works and they get pregnant in the end. When I started with the training for the hormonal therapist, people come with a problem. The problem is not different than it was in the hospital.
hmm
But I learned to look behind that problem.
mm
Why is this a problem? And what are the reasons or the things in life or in the people's life um, which could have had an influence and maybe caused this problem? And yeah, it was a complete difference of focus.
hmm
And to be honest, if you talk about nutrition, I didn't learn anything about it at med school,
mm
nothing.
hmm
And if you think we are what we eat,
hmm
it's simply we put it in our mouth, we put it in our body, nothing. So it's really, really weird, actually.
Yeah. Yeah. And how was that the reason that you made that shift also? So you started your hormonal health training while you were still working as a fertility doctor?
Yeah, yeah, it was at the same time. Yeah, because I saw so many patients, I couldn't help.
hmm
And of course, I can put them in the protocol, and well, sometimes didn't stick to the protocol, but did did something different or something extra.
hmm
But still, then they asked me, okay, what can I do by myself to improve my fertility? And I said, well, maybe you can eat better, don't
hmm
drink,
hmm
get more movement, or physical training. That's it. I
Yeah.
didn't know. And it was so I was a long time working in the hospital, so it had the medical part. It became a bit more like, I know all the skills and I know the drill and I know what to do, but those questions I couldn't answer. I don't like it if I don't have any answer.
Mm-hmm.
I think that was it. That I had the feeling that I could have more knowledge and more skills to help people. Yeah,
Yeah.
I think that's it. Yeah.
It does sound a little bit strange though that we have all this knowledge and that it's not integrated in the medical. I remember going in for my transfer for my last pregnancy,
Mm-hmm.
and there was a wait list because of COVID. So I'd already done some tests with my own doctor, and I knew my vitamin D levels were really low. So I've been
Yeah.
working on getting them up, and I was going in for the transfer, and I told them, look, my vitamin D levels are really low. Or
Mm-hmm.
I've been working on that. Is that something we need to test? And she was like, yeah, don't care. This is
Yeah.
the protocol. Um,
Yeah.
and I find that such a missed opportunity that you have all this knowledge that is out there. Yeah. And so what do you do differently now? What's different in your approach?
What I do is looking at the individual or individuals, if it's a couple, and I ask them so much more questions than I ever asked as a doctor in the hospital. I need to know, how do they sleep? How do they go to the toilet? What do they eat? Are there any stress levels? How were they born themselves? It's really, I always say to people, I really want to know everything. And the longer I do this work, the more I match with fertility. So it's getting a questionnaire which is still getting bigger. What I do afterwards is of course, we have an intake, we have a meeting, and then I try to put myself in the situation of this patient, and I think, okay, if I were them, what should I do? What would I do to improve my fertility? And that's the advice I give. It's on food, it's on supplementation, it's on extra laboratory tests, it's on different IVF treatments, or going to a foreign country or a different hospital. It doesn't have to be a foreign country. For some people, I recommend a constellation because there's so much in this family. And so it's really broad, and I give them all the information. And after getting this fertility plan, that's what I call it, I work with a hormonal questionnaire. I check it every 3 months, more or less, to see if there's something happened. And it's just like they have their personal fertility doctor with a broader scope that know their situation. And well, in the end, of course, to try to improve their fertility and their confidence, because the mind is also important.
Mm. It reminds me a little bit of Dr. House.
Oh,
It's like having a puzzle and really like trying to unravel that
yeah,
entire
yeah.
puzzle,
But I
finding all the
think
pieces.
Dr. House was a bit less compassionate.
True, true.
And to be honest, I'm not that gray like that.
Yeah. But I maybe sometimes feel that, those television shows, they give us that impression that doctors are there to really get to the core of your problem. And as you were
Yeah,
saying, that's not
yeah,
really how the medical system works. It's much more about addressing symptoms rather than finding those root
yeah. And to
causes.
be honest, yeah, I really think in vision. So I
Mm.
thought I saw House, and I thought, no, that's not me. But what he does is,
Mhm.
yeah, actually, you're right. Because I always say to people, I can't guarantee, of course, I can't guarantee
Mm.
any children or pregnancies or whatever. I even can't guarantee that I find a problem,
Mhm.
but I do look after the possible causes, of course.
Yeah.
And when I had my own experience as a patient having a child with, I thought, okay, what do I want? Of course, I really want to have a healthy baby, but I thought, if it's not given to me, I really want to know that I looked for causes, I looked for possibilities to improve my fertility, the feeling that you've done whatever it took. And
Mhm.
you don't have to do everything. And that's, of course, what most of the time women do. They look for so many options, and they're completely going nuts and stressed on all the things they want to do. But that's not what I meant. It's just the the most important things you want to do. Do I make myself clear?
Yeah, no, definitely. And also, I think really important, um, like you said, it's so easy to get that sort of checklist approach where you feel like you need to do everything,
Yeah,
and it becomes super stressful
yeah,
because all you're doing then is thinking about your fertility, what you're eating, what you're doing, how you're sleeping, what you're drinking, um, how you're visualizing, how you're thinking. Are my thoughts not too negative? And it becomes such a huge
yeah.
burden. So that's really important to see.
And
But
it will not give you any guarantee.
yeah,
Yeah.
yeah. And I know in your work that you combine Eastern and Western approaches. So where does the Eastern come in? The Eastern medicine, the Eastern wisdom in your work?
In a cycle,
Mhm.
there are some symptoms on which doctors say, "Oh no, it's normal. You need to live with it. If you have pain during your period, or you have symptoms before starting the period, or your period is just 2 days, or with very little blood loss, or whatever, and such kind of things. As a doctor, we can't do anything about it. We don't have anything to fix that.
Mm.
Of course, it's not normal. It's a hormonal disbalance. So
Yeah.
what I always do is, for people I know, the things to look at and say, hey, this might be a problem. So then I send them to
Sure.
some Chinese doctor or
Yeah.
Ayurvedic or whatever. Yeah.
Yeah. Yeah, that was such a huge eye opener for me as well. I trained to become an abdominal therapist this year. So that's a healing tradition from Central America, like
Oh,
ancient Mayan belly massage.
oh, wow. Oh, so I can
Uh,
people
oh yeah, you can
send my
send.
people to you.
Well, you know what the good thing is I teach everyone self-massage.
Ah,
That's a
okay.
huge part. So this is really about empowering women to take charge over their hormonal health again, because the
Yeah,
belly
yeah,
massage is also very much focused on that hormonal balance.
yeah,
And it was such an eye opener for me when they told me, like, a normal period isn't painful. You have normal
yeah,
blood flow, it lasts for a couple of days. You don't have
yeah.
PMS. Um, it just goes to show like the lack of research that's out there. And we know this, like women's health is just understudied.
Mm-hmm.
But also the lack of self-care that in these ancient traditions, in some Mayan
Yeah,
culture or in Eastern culture, like women know how to take care of their hormonal health. So
yeah,
it's so crucial to bring that back in. Again, having
yeah.
that empowerment again, empowerment of women to.
Yeah, and that's the same thing I always say to people. When you are the captain on the boat,
Hmm.
it's your to be honest, it's your own responsibility, because it's your body
Yeah.
and it's your hormones. But the doctors in our hospitals don't teach women and how to check, how to actually. No, I think it's even more deeper. I think we just forget two things. One is that we're part of nature,
Hmm.
and the second is that we forgot to feel. We are
Mm.
completely in our heads, thinking all day. And what I always say to people is, when you try to get pregnant, um, there are not much things that I know for sure, but I
Hmm.
do know for sure that you will not become pregnant in your head.
Mm.
It needs to happen in your belly. So if you're continuously busy in your head and you don't have any feeling with your body, I'm not saying that you will not get pregnant then, of course not.
Yeah.
I got my second child, my daughter, after the third embryo transfer after IVF,
Hmm.
when I had my burnout.
Hmm.
So I was really stressed.
Hmm.
Um, and then she came. So it's not that I'm saying that it's not possible when
Yeah.
you continuously in your head. But if there is a problem with getting pregnant, yeah, please try to yeah, live
Start
more,
feeling.
start feeling, be more
Yeah.
in your body. And to be honest, it's not even for having a child wish or for your fertility. It's feeling a lot better
Hmm.
because you are in that body.
Yeah. 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 It's so important.
Yeah, yeah.
And then you briefly touched upon that sort of emotional, mental side as well, and the family constellation work. And I know I saw on Instagram that you're also training to become a family systems therapist.
Yeah, when I started my career, I was a medical doctor. Afterwards, I became a hormonal therapist. I learned a lot more on foods, on vitamins, on hormones. I'm working together with someone who specialized in the guts and in the immune system. But still, when I saw people at Sakura, they just sent me messages on everything in their life that's going on. So I really know where they are, who they are. And for some people, I thought, okay, the medical part, I couldn't think of any better treatment. Hormones are in balance, the gut is fine, they eat whatever they need to eat, vitamins are good, but they're still not getting pregnant. Why? And then I thought, okay, I'm kind of addicted to personal growth. So I'm reading and I'm learning and I'm going to my coach for a couple of years, every 2 months. And sometimes I'm driving to her and I think, well, everything is okay. What the hell do we need to discuss? But there's also always something we can discuss.
Yeah.
So for patients or clients, I thought this is also a part of them. And family systems also have influence or can have influence on child wish. I was with a constellation a couple of years ago, no, 1 year ago, and there were 5 women who said, no, we don't have a child wish. And women between 35 and 45 or something. And this coach was saying, okay, of course that's possible. And then they did the constellation, and 2 of those 5 women afterwards said, oh, but I think I thought I didn't have a child wish, but now I know that my grandmother got her child, need to quit working, got depressed of her life after having a baby. So it's in the energy, maybe. I don't know. It's not my profession, but I thought maybe it's in the energy, and that's what the coach also said. That if you know that when you get a baby, your life will be completely different, and you might get depressed because you don't want this life. It's the reflection of the grandmother.
Yeah.
Maybe then you decide, I will not have a baby.
Yeah.
And at that part, I asked the coach, okay, but wait, I do see people who just want to have a child, but they don't get a child, or not at this moment.
Yeah.
Is this also working in this way? And she said, yeah, well, maybe. So that's why I took this part also in the scope of my program. Yeah.
Yeah.
And not for everyone, because some people think, okay, I come to you, you are a fertility doctor, you tell me I need to discuss or level on an energy-based with my grandmother. Cuckoo.
Yeah. But maybe you recognize. So I'm originally a researcher myself as well. So I made this shift to this work, and I come at it much more from that energetic point of view.
Yeah.
And still I find it's so you see these beautiful things happening.
Yeah.
And still I find it so difficult to really claim that, because I cannot prove the causal link that was there. I'm just thinking of, like, I have this ritual group now with women where every week it's all women who are trying to get pregnant. Every week we light a candle for one of our members and send her like a prayer. So
oh wow, yeah,
they all get like
beautiful
pictures. It's really beautiful. And we had one woman going in for IVF treatment, and she texted us the day before. We were supposed to light the candle on the day she got her transfer, and she texted us the day before saying, well, my lining is too thin. So, and she was even abroad, so she was having to go home. Didn't know when she could come back. So she said, can you all light that candle for me so that hopefully this will work out? So we did. And then next day, she texts us, okay, my lining is now thick enough. I don't have to cancel the treatment.
Yeah.
And, those are the things that happen. And you're like, okay, if enough of these things happen, you do feel that something, it's just, I don't know, we're so rational, I think, especially in our culture.
You can't explain. And to be honest, my first thing is, oh, maybe they didn't measure it in the right way the day before.
Yeah. Yeah.
And because I
Yeah.
still have a
Yeah.
part of my brain is a doctor's brain,
Yeah.
but it's exactly what you're saying. And I see so many miracles
Hmm.
in my job, in my work, that I never say something is impossible.
Yeah.
And that's sometimes I'm afraid that I am too positive.
Yeah.
And doctors, we are really taught to not give any hope if there
Mm.
isn't any hope.
Yeah.
But yeah, I do see the miracles.
Yeah.
Yeah, and
Yeah.
also so on this unconscious part or energy part, and I
Yeah.
really can't explain. But now I know we don't have to explain anything, and it might be this might sound a bit weird from a doctor who did research, who
Mm.
had her PhD. But for me, as a human, it resonates so much more. We don't have to know anything, everything.
Yeah.
There's so much we will never know,
Yeah.
and it's okay to not know. The only thing is that I think that we need to know that we don't know anything. Can you follow me?
Definitely. And that's what I like where you said, like, I don't promise a pregnancy, and I'm the
Of
same.
course,
It's like I see people advertising that way, and I feel that's really because
but
in the
they
end,
can't.
yeah, so many women do get pregnant.
Yeah, that's true, but we can't promise.
We can't promise, but you cannot even explain whether it was your work or just
No,
women
I
getting
don't know.
pregnant.
Sometimes
Yeah.
I really don't know.
Yeah.
And
Yeah.
to be honest, I never publish any pregnancy rates or whatever,
Mm.
because I have so many clients in their whole stories are so different.
Hmm.
I do have a woman now, which is a client. She's 47,
Hmm.
and you would say, why the hell are you still helping her? But
Yeah.
she said, my whole family, all the women got their pregnancies when they were older. I
Hmm.
still have a regular cycle. I
Mm.
got 2 miscarriages, um, and no one wants to help me.
Mm.
And I thought, okay, if people know what their odds are, and
Hmm.
of course, the odds for these women are very low,
Yeah.
but at least we can look if there's something we can improve. But for her, probably she will not get pregnant. I don't know. I hope, of course, and we work
Mm.
on improving her fertility. But she knows that I can't prove anything. On
Hmm.
the other hand, I do have some younger people who say, okay, I have PCOS. I got the diagnosis when I got 16, and the doctor said, told me to come back when I have a child wish because I need to get a hormonal treatment. I don't want a hormonal treatment. Can you do something?
Hmm.
And if we improve their hormonal balance, their immune system, and they will get their period back, or their cycle, they get pregnant very well, easy. It's not
Yeah.
easy, but it's much more easy. I do see people after having 6 or 7 miscarriages, or
Hmm.
after having 4 or 5 IVF treatments,
Yeah.
and still a lot of people get pregnant. It's exactly what you say. I think almost 85-90% of the people get pregnant, even is in this population, which is not the best population if you
Yeah.
look at their odds
Yeah.
or chances. Yeah.
Yeah, that's a good message to put out there, I think, because I remember it from my own journey. Like you're always thinking, I'll be the one, but it's
The
really
one, which one?
where it doesn't work. The one
Oh,
who will left childless. And
yeah, that's your biggest fear, probably.
yeah, yeah.
Yeah.
And so I know that you've been writing a book as well.
Yeah,
Can
I did.
you tell us a little bit about your upcoming book?
Well, it's called Improve Your Fertility, but then in Dutch, Verbeter je Vruchtbaarheid. The publisher asked me to have it in 2 parts. So it's one book, but part one is the medical point of view and
Mm-hmm.
all the possibilities in the medical setting. So the diagnostic tests, when you first know, okay, we need to go to the hospital to check why we're not
Mm-hmm.
getting a baby in the normal way, on ovulation induction, all the treatments, IUI, IVF, ICSI, whatever. There's also a chapter on recurrent miscarriages, a chapter on if you, and the medical treatments without having a pregnancy or baby. And the second part is on my more holistic approach. So it's on the foods, hormones, hormonal balance, egg quality, on the sperm, of course, for the man, on the mental part. So it's, everything I think which influences fertility is in the book.
And is there anything new that you learned while writing the book? Because I can imagine you went through all the research again.
Yeah, I did. Well, yes, I had more insight in the immune part. And I'm working together with a Greek gynecologist who's having his own IVF clinic in Athens. And he specialized on the immune system. I read a lot more books on the immune system. And there's not a really big part on the immune system in my book because, there wasn't any space. I think it's 380 pages. I'm not quite sure, but it's a lot.
Yeah. And so what was it that caught your attention on the immune system?
Yeah.
What did you learn that was new for you?
When I became a doctor, a gynecologist, and I specialized in fertility, and you don't learn anything on the immune system. And this Greek doctor, I spoke to him first time it was, I think, in February this year. And I do see a lot of women with recurrent miscarriages. I do see a lot of women with a low ovarian reserve. And he said it might both have an autoimmune cause. And I was like, So what I recently did was for my patients, they already had a very broad, extensive questionnaire. I made one extra with an immune checklist to see what is going on in your immune system. Is there anything who's fighting against you, and what can we do about it? So I learned a lot of things, and it's still, after the book was finished, I thought, okay, what do I know now? And I really had to process all the things. And to be honest, I'm afraid I will never stop learning.
Like I did an episode about gut health the other week. I still have my notes here in front of me.
The gut.
The gut. So this is my notes on gut health and the link to the immune system. I'm showing them for those of you who are listening and not viewing. Everything is so related: immune function, hormonal balance, the thyroid.
Yeah, but that's it.
The brain, metabolism, and
so many things start in the gut, and no doctor will ask you how and when and how often you go to the toilet when you're having a child wish. Why not?
Yeah. That's also what I concluded that episode with. Like, look at your poop. How are you pooping?
That's it. To be honest, I think at least 50% of the women I see having problems with defecation, with their belly, and it's not the menstrual part, but just the gut. So many women. Yeah.
Well, I could talk to you for hours. I feel we have so much more to discuss, but I am also mindful of your time.
We have to do a second podcast.
A second session. So just to round up the conversation, what would be your general message for anyone who's dealing with fertility issues and their pregnancy loss?
Well, I think it's also something I wrote in my book. Listen to your body. And your physical complaints tell you something. So don't ignore them. And don't let the doctor tell you it's normal, you have to live with it, but look further. And I think what you also mentioned, you can do a lot of things to improve your hormones, to improve your fertility. And if you feel that you are in charge of these things, it will just give you more confidence. And a second thing is that I learned from my personal life coach. She said, we don't decide on life or death, we as people. It's not on us. It's not on us. We don't decide on it. So you can do a lot of things, but it's not completely in your hands. And that's why I can't guarantee children. And if you have a child wish and you know that it's not 100% in your hands. On the one hand, it might feel a bit, shoot, what can I do? But on the other hand, if you turn it around, you can't say to yourself, if I've done this or this or this, I might have got pregnant. And it's due to myself that it didn't work. So you can't blame yourself. I think that's maybe the most important message.
It reminds me of something that came up on an earlier podcast where we were talking about the mystery of conception.
Oh,
There
yeah,
is
it is a mystery.
There is a mystery to conception.
And it's magic.
And it's magic. And we will never fully know.
No.
And you will never fully be in control.
No.
Yeah.
But we try so hard to be fully in control.
Yeah.
And for my patients, clients, whatever, I try to learn them not to try that hard. I teach them what things I think you can do. I never say you must do something because it can feel for them as a stupid idea, although I think it's my best idea for you. So they don't have to do anything they don't want, but I give my best advice as I can give. Focus on that and try to surrender in this last part, in the question mark, in the big mystery part of getting pregnant.
Yeah. Well, thank you for a beautiful conversation, Kimiko. If people want to find out more about you and your work, where can they find you?
On my website, Sakura Clinics, I think it's .nl. To be honest, I'm not quite. Yeah, it's .nl. Or on Instagram, just Sakura Clinics. And of course, 5 November at bol.com or the book stores with the book Verbeter je Vruchtbaarheid.
I'll put all of that in the show notes. The episode
sounds good.
will come out in December, so that means your
my
book will
is
be
in there,
available by then.
Yeah.
And thanks also to the listeners for tuning in this week. If you want to reach out to me, you can find me on Instagram at thatfertileFeeling or email me at francoise@thatfertilefeeling.com. I always love to hear from you and I always get back to you and hope to see you back next week. Bye-bye.